Hey, Dr. Shakib here from Irvine Spinal Wellness Center, your Irvine chiropractor. I am here with Cole. I just did a video on his story. He's waving. But I wanted to show you what I will be doing, partly what I'll be doing with Cole's foot. So he already has a plantar fascia issues. And Cole, go ahead and flex your ankles right there. And so I'm just softly going in through, and right there, this is where I see the fascia being much harder and more involved in this side. So I'm just going to hold a slight bit of pressure, and can you let go, relax this, and then pull it towards your nose again.
Yep.
And I'm barely pressing it, and relax it, and do it again, and relax it, and do it again. So Cole, as you can see, this is the belly of the issue. Relax it. So I always start with the perimeter, but the outside. Go ahead and do that again. But I really want to, don't use your quad so much. This is just, so you see this, it hurts. So he's using his quad, which is his hip flexor. Remember that video? I'm gonna make sure it goes at the bottom of this thing, this video. But you can see this is a hip flexor issue. Cole, did you notice that?
I did, yeah. I didn't once you said it. So what do you mean? I'm not using any of your muscles.
You crack me up. Go ahead and flex it again. Right there. So Cole, really relax it, gently relax it, gently flex it. Keep going, go, 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 and gently let go. Hurts like hell, doesn't it?
It's a little painful.
Go. He's kicking me with the other foot. So Cole, really, you could be doing this yourself at home, but this is only palliative, meaning it will help you right at the moment. But if you don't, go flip over on your back. If you don't fix the problem, the source of the problem is just going to come back. Hold on to the table a little bit better. Nice and relax it. Hold on a little bit better because I'm going to pull. There. Did you feel that?
Yep.
Nice and relax it. Relax. All right, so that did not, but this bone right here, Cole, was sitting a little bit in front of the rest of you. That's because it doesn't, you're not moving it correctly.
Yeah.
Does that make sense?
Yeah.
Flip over on your tummy. Gosh, it's hot in here. Nice and relax. Scoot down so your shoulders off the head, please. Take a nice deep breath in. All the way out. One more time. Jeez. That one was dying to move, right?
Yeah.
This side up.
I mean, haha!
Face me this way.
It sounds worse than it feels.
Don't mind the mismatched socks.
Yeah.
That's Cole's thing.
That's my style.
That's his style. Goes with the hair. Relax it.
Along with my scratch feet.
I just love teasing this man. He begs for it.
Well, it's funny because that's probably like why my wife's noticed that my limp on my right side.
How?
Like I don't walk normal apparently. She noticed when I was walking up the steps of our apartment. She's like, you know, you're like got like a pimp limp, and I was like, I do, and she goes, yeah, you have a limp on your right side, and I was like, oh, I don't know why.
You mean you didn't have any pain that one with it?
Yeah, it's not pain. It's not any pain. It's just more along the lines of I would walk with this foot, and I could feel myself limping. I don't know why.
So here's your clue. Your plantar fasciitis starts way before the pain, right? Relax it. One more. There we go. And one more out down here. Chin up. Chin up. All right, you can go on. No. So this right here, Cole, but that's the side that you're pain. So that's always engaged. Anyway, this is just the adjustment part. The rest of what we do with Cole is out there with developmental kinesiology, and I'm hoping we're going to pass what we need to do so we can start some of the brain-based neurology exercises. Anyway, thanks for watching. And please subscribe to my YouTube channel. Ask me any questions you may have. You can private message me, or you can do whatever. We'll put all the contact information in the description box. And thank you for watching. Take care.